right, Dan, thank you. Opioid and heroin addicts in Utah will get an infusion of treatment funding from the federal government. The money will pay for recovery drugs and counseling. News specialist Jed Boal is live in the newsroom with more on the two counties needing the most help. Jed?
Yeah, Dave, right now, prescription opioid and heroin abuse are at epidemic levels across the country and here in Utah. In our state, 30 to 40 people die from heroin or opioid overdose every month. So any help for recovery is critical.
It's a very significant public health problem.
Alcohol abuse still lands more Utahns in public treatment, but heroin is trending to surpass alcohol soon.
It's been a steady upward trend for about the past 8 years.
Today, nearly 3,600 Utahns are being treated for heroin or opioid addiction in public programs. And there are nearly that many patients in private programs, too. So the Department of Health and Human Services award of nearly $350,000 to an Ogden-based clinic will help addicts.
This is a big deal for those individuals that need it.
Midtown Community Health Center will use the money for recovery medication for 80 prescription opioid and heroin abusers at clinics in Weber and Davis counties. The clinic is also hiring a substance abuse disorder counselor and will increase the hours for their psychiatrist working at their homeless clinic.
We feel it is a thing that is happening in Utah more readily all the time and wanted to be able to help these individuals.
The medications are important recovery tools that were not available to addicts in the past.
We're learning more and more about the disease of addiction every day, and we're trying to translate that to the field.
The Midtown Community Health Center is an integrated public health provider, so those getting treatment for addiction can also take care of other health issues while they're in recovery.
That's some good news. Jed Boal live in our newsroom tonight. Thank you, Jed. Dee Dee?